Good morning, everyone. This is Dr. Susan Marra with Dr. Marra's Medical Minutes, and today we're going to talk about aggressive and thorough treatment of tick-borne illness and mold illness. And the reason I bring this up is because I had a patient, brand new patient yesterday, who is really, really sick. And he chose another practitioner because he didn't think that I would be aggressive enough with his treatment because I was a naturopath. Well, that couldn't be any further from the truth, because if you look at who I was trained by, Dr. Charles Ray Jones and Dr. Richard Horowitz, both of those physicians are heavy hitters for the treatment of tick-borne illness, and they had a high rate of getting people well, and so do I. So, what do I mean by an aggressive treatment for a doctor? Well, I'm as aggressive as you want me to be, and I'm not reckless. You know, we do labs every month, to check and make sure that your liver and kidney are okay. Look at Juju. And, whatever else we need to monitor, thyroid, hormones, if we need to do an ultrasound, EKG. I'm not reckless. I am thorough, but I am a heavy hitter. And the reason that I am is because I believe that's what works. And I know it works because I'm living proof of it. Now, that doesn't mean that I don't relapse. I do. When I have a big stressor like a move, I generally will relapse a little bit. But I use up to 4 antibiotics. It doesn't have to be 4. It's on an individual basis. Some people only need 2. Some people need, 3 antibiotics and 2 herbs. Some people need only herbs. Some people need, everybody is different. But I am absolutely a aggressive and highly skilled practitioner. I've been doing this, 26 years. It'll be 27 years in May. And, it's what gets people well. And it's not for everyone, I understand. Some people want to do, ozone and all these other kind of things, and that's fine. This probably isn't the right practice for you. But if you'd like to do high-dose herbs and antibiotics with nutritional support and red light, we're going to have a red light bed here real soon. This is a great place for you. And I would say that I'm probably one of the most aggressive Lyme doctors in the Pacific Northwest. And I don't mean that in a mean way. What I mean is that I use high-dose antibiotics, and several of them. And, most of the patients that I have, they have 5 to 9 infections, plus mold, plus COVID vax, plus EBV, plus pneumonia. It gets complicated quick. And so that's why I do what I do. I do use high-dose antibiotics, and I use high-dose herbs, and I use them together all the time. And I have been for 26 years. This is not new for me. So if you'd like a seasoned, aggressive physician for tick-borne illness, I'm probably a good bet for you. And you can find me on my website, www.drsusanmarra.com. And you can read all about what I offer, what I do, and then you can give our office a call, and you can talk to Michaela, and Michaela will also talk to you about what we do here. But, we do have a really good track record for getting people well. I didn't say that we cure people, but we do get people well and put the infections into remission. And for most people, they go on and live very normal lives. They go back to work, they get married, they travel to Europe, they, buy a boat, whatever they do. And that's what I hope for. I hope to get you guys well enough to be participants in life again, because that's what you deserve, and that's what should happen. I do not believe in dragging you guys through the mud. Absolutely not. So I hope you found this information helpful. My dear Juju, she's going to be a year old at the end of this month, and she's doing such a good job in the office, aren't you, Juju? Yes. I hope you guys have a wonderful day. Take care. Bye-bye.